Good morning, everyone. It's Dr. Joleen Falkenburg from Niobrara County Hospital. This is your weekly COVID update. I waited until this morning knowing that we had a case pending that was highly suspicious, and the Department of Health will confirm this morning that we have a positive case. I saw this patient on Monday, seemed highly suspicious, and treated the patient as such and asked for self-quarantine. I know everyone will be interested to know who it is, but that is why we have privacy rights. And the Department of Health investigates contacts so that we can prevent the spread of transmissible diseases. That's actually why the Department of Health exists. They've been doing this long before COVID came along. There have always been reportable diseases that we offer to the state so that we can lower risk of highly contagious diseases. So they will contact the patient, and I want you to rest assured that there was not a lot of contact with many people in the community. So please don't panic or worry. We have suspected that COVID has already been here 2 to 3 weeks. That's why we put the precautions in place, especially protecting our extended care residents, having a clean versus possibly contaminated space within the hospital and the clinic, and why we have screened all of the patients coming in and out. So now we understand why we have put those things in place, and I hope it makes you all feel validated that you have socially distanced and shut down your stores and suffered financial complications from COVID, because it is going to come through. Our intentions were never that we could completely stop it, but if we can slow the infiltration through our communities, it will lessen the burden on our hospital systems. If anyone has questions or concerns, please feel free to contact us. We will try to get more information through the Department of Health as it becomes available, and we'll continue to test as it's deemed appropriate and necessary. But I have believed it's been here for a few weeks, so continue hygiene issues and social distancing as best as you can. I wanted to comment to the CDC recommendations to wear a mask in public places. That's really if you just can't socially distance. So you go into a crowded grocery store where people maybe aren't respecting your personal bubble. If you're walking down the streets of Lusk, Wyoming on a sunny day, you don't need to wear a mask. And the mask is not decent enough if you still don't wash your hands. So as an example, if someone coughs in their hand, touches the green bean can that they stocked, you purchase it and take it home, but you don't wash your hands, that's how you can transmit this virus. So the mask should not take place of good hand hygiene. You have to be careful about how you put it on and take it off. If you touch it with the possible contamination on your hands, obviously it's just like touching your face. So be careful that you're putting it on and off the proper way you should and storing it in a bag so that germs can't collect on it. I also wanted to comment to just trying to stay within your social circle. Please don't take the time right now to travel to Casper or Cheyenne or urban areas that have higher case amounts for COVID. If you want to help with cattle work or other things, I'd like you to still, once again, stay within your social circle. And the governor still does have the recommendations and mandates to keep within a group of 10 or less. We are going to start offering more telehealth visits because I know there's certainly people out there with chronic health conditions that we need to help. There'll be more information as I do some demos today as to how to best provide that. We will do phone call visits and we have Zoom meetings established, but I have another platform I'm working on today to make it easier for people to just get direct text right to their phone. I'm going to do an interview with the Tri-State Livestock News today regarding branding guidelines. I know a lot of people have been interested in that. It's walking a fine line to practice appropriate medicine and respect what the medical team all needs, as well as give appropriate guidelines that ranchers will actually follow. So I hope that that is helpful to you guys, and it should probably come out next week. Any questions? We're here for you. The clinic number is 307-334-4000, extension 223. We are planning on closing the clinic tomorrow because I needed everyone to sort of have a break to be with their family coming up on Easter weekend. No one's traveling or doing anything extreme. I will be around still for phone calls, and I'm still meeting with public health, and if I'm necessary to be on site, I'll certainly be here too. So let us know if you need anything. Have a great day. Please don't panic or worry. We knew this was going to come through, and hopefully the sooner it comes through, the sooner we can all get back to our normal lives. Thanks, and have a good day.